We were on a ski vacation over Christmas about 4 or 5 years ago.
My skis crossed in the back and I hit a tree.
They realized that she had a femur fracture, but in her growth plate. After she completed her growing, would have had a 2.5-inch discrepancy from one leg to the other.
Originally, I was with a doctor in Houston.
He explained the PRECICE system to us, and I knew that at the time it was a fit because I didn't want to go through having an external fixator.
We were scheduled to have the surgery with him to install the PRECICE system. Then he retired.
It was like, oh my gosh, we couldn't believe. And we asked him if it was your child, what would you do? And he said that he thought Dr. Dahl had a great history with PRECICE, and that's who he would recommend.
When a family decides to have a bone lengthening procedure, we analyze the patient by examining them, getting a history of how this developed, what their specific problem is, and realistic goals of what we can accomplish, and make sure that you've got a match, and make sure that your expectations will be satisfied. So you can see here this sweet little child has got a short leg, and this right leg is 3.5 centimeters shorter than the left leg. We want to do an osteotomy right through this healthy portion of the bone here, straighten the bone at surgery, and then put the rod backwards up inside her femur, lock it in place, and then begin the lengthening about a week later.
I had to do the limb lengthening 4 times a day for a minute each time.
You know, it was a part of our daily life for the regimen that he prescribed.
If a child has a fracture and they heal it, that big callus forms and eventually shrinks up, and oftentimes the bone straightens itself spontaneously and remodels with growth of the child. And there are times that a child can have a fracture at the age of 4 and you can never see it on an x-ray at the age of 14. The same is true with bone lengthening sites. This is a sample of the device after it's been fully deployed. So at the time of the surgery, where the marker is placed, we identify exactly where the magnet is inside the patient's leg. The device looks like this. That is placed directly over that, and you can look right in the viewfinder and see your X.
She could do everything. We swam in a pool, we went and visited her friends at camp, we went to a baseball game, and you couldn't tell that there was anything going on with her.
Here she is 1 year later. You'll notice that her legs are nice and straight, they're matched. The rod has done its job, and the body has done its job. Removing the device is straightforward. It's best if the surgeon that put it in is the one that takes it out. Generally, not too much pain afterwards, generally not too much restriction of activities.
Going through the physical therapy, it was a challenge. It was painful, and she didn't want to do it every time because you have to know that it's a commitment. You have to go to the doctor, you have to do the x-rays, you have to do the lengthening even when your child doesn't want to, even when it's uncomfortable. So I would say it's going to be worth it in the end, and now that she's able to participate in everything she wants to, she realizes that all her hard work paid off.
I really love the arts. I like singing and dancing and acting. I hadn't done just dance, and I really wanted to try it. Now that I've had the surgery, it's just so much better. It's changed my life.